This is Michelle Moore, and it's Professor Saltman's class. I'm doing speech number 3. I would like to talk to you, first of all, let me thank you for coming this evening, taking time out of your busy schedule to meet with me. And I'd like to talk to you a little bit about something that I feel is hurting the nurses the new nurses that are coming into the profession. Currently, trying to find a job in this city is extremely hard. Everybody wants you to have experience. Everybody wants you to be a seasoned nurse prior to getting into the hospital. Unfortunately, these requirements change with each individual hospital. They decide what they do and they don't want in their experience. One of the problems that nursing in general is running into is that nurses don't have a common ground for entry-level positions. If you look at some of the positions that may be within a hospital, like a dietitian, in order to become a dietitian, you have to have a bachelor's of science degree. To be a lawyer, you have to have your BS degree and then years of school in specializing in law. But nursing, there are several different levels in which you can enter. You can enter in as an LPN with 1 year's worth of training. You can enter as an associate's degree RN with 16 months of training, or you can enter in as an RN with a BSN 4 years of training. The associate degree and the Bachelor of Science registered nurse, they all have the same capabilities. They're both licensed by the state. Unfortunately, they're looked at as being different by the facilities that are here in town. Another problem is the lack of respect that the individuals are receiving within the positions. Many nurses complain that the doctors don't respect them. They don't receive any respect from administrators in the hospital, and even advanced practitioner nurses are not interested in giving them ultimate respect. So this kind of prevents the nurses from going forward and also causing them problems when they go into their jobs. Nurses today are placed in very dangerous situations. There's not enough staffing for the nurses to do their job appropriately and the level in which they do. There is a lie that is going around that there is a nursing shortage. There's actually not a nursing shortage. What there is there's a shortage of registered nurses and licensed practitioner nurses who are willing to put their careers on the line, because the facilities they go into, they're required to take care of 8 or 9 patients at a time, and they're not willing to put themselves in that kind of jeopardy. Right now, what you're running into is in 2008, the baby boomers started retiring. So now you have individuals who need more care. You have more nurses out there who are afraid to give them the care because of the lack of respect and the lack of knowledge that they have. So hopefully what will happen is the nurses will be able to unite, and that they will be able to set the standards into play that will help their profession to set certain guidelines like you have on other professions such as lawyers or doctors or anyone who has higher learning and has a lot of influence with the people that they're taking care of. Hopefully this speech today has opened your eyes on different facets that new nurses face and different problems that they're facing when they try to get their jobs and become employed. Thank you for your time. Have a lovely evening.